When emergency first responders were overwhelmed by Los Angeles County's most destructive fire yet, a band of surfers, along with their neighbors and friends, stepped up to defend their home turf in Malibu. Their devotion to home drove them to show up for their community during the fire and for years afterward. And now, a model they call the Community Brigade program could change everything, leading to more lives and more homes saved during the increasing wildfires across not just California, but the world. Join reporter Adriana Cargill from KCRW, NPR's All Things Considered, Crooked Media, and more, as she investigates a wildfire story that is not depressing, but is, in fact, a clear hope for the future. Listen now to Sandcastles, an award-winning podcast about home, how we create it, and why we fight so hard for it. Welcome to Important Not Important. My name is Quinn Emmett, and this is Science for People Who Give a Shit. And these conversations give you the stories, tools, and action steps of the world's smartest people and that you can use to fight for a better future for everyone. Those guests are scientists, doctors, nurses, journalists, farmers, engineers, professors, policymakers, astronauts, you name it. This is your friendly reminder that you can send questions, thoughts, and feedback to us on Twitter at ImportantNotImp, or you can email us at questions@importantnotimportant.com. You can also join tens of thousands of other smart folks and subscribe to our free weekly newsletter. It comes at you on Fridays at importantnotimportant.com. You can also find fantastic sustainable merch like stickers, t-shirts, coffee mugs, and such on our website at importantnotimportant.com/store. Folks, this week's episode is an unintended follow-up, though I will always have this person on the show as long as they'll have me. We are talking about what we've learned from COVID, and most importantly, where we go from here, knowing what we know and what we don't yet. Our guest is, again, she's back for her second time, Dr. Naheed Bhadelia, and she is one of the world's leading infectious disease specialists. She's back, and let's all agree that next time she says, a pandemic might happen soon, we just go ahead and jump. Nobody knows the technical side of this stuff better than she does, and I'm very excited to share this conversation with you today. Here we go. Our guest today is inexplicably back for another round, one of our all-time favorites, Dr. Naheed Bhadelia, and together we're talking about, a lot of things have happened since the last time, big changes, small changes, talk about what we have learned, what we haven't, where we're going as a society, economy, public health, and each of us individually. And I'm excited to talk to this human. Dr. Bhadelia, welcome back.
Quinn, thanks for having me. It's so funny. Last time we talked about this existential threat of a pandemic. And, what is it, a year and a half later, we've lived through
100
a huge
years.
Part of that. Yes, we've aged definitely 100 years in that period. But we've lived through that existential threat. And it's interesting, the perspective that we all now have, both individually, but as a society, that we didn't in the last year and a half.
Yeah, and look, there's been, and we'll get into all of it, right? There's just been tremendous suffering and tremendous sacrifice on the part of so many, and yet it's sometimes, this is what my wife is like, when she says, like, I have acquired over the past few years the unique ability to be the bummer in every conversation with this generalist view of everything going on in science. But it's obviously hard to not be like, you think this is bad? Wait till we talk about antibiotics or, or what's going on with climate. It's like, now's not the time. Let's hold on a minute. But, I'm excited to talk about what we've learned, what we knew ahead of time and we didn't use and where that stuff has taken us. Because again, I think if you listen to our first one and then get into this, we could have done a little better. So anyways, let's dig into this thing. Again, it's always sort of action-oriented questions, and then what everyone can do for themselves, for their cities or towns to support you in your mission, which is to save the world, I believe is your title. So you answered this once before, but maybe that's changed now, maybe not. Nahid, why are you vital to the survival of the species?
I am vital because I serve as a voice that reminds us that we continue to have this existential crisis, and that when these crises hit, they generally take advantage of the fault lines that already exist in our society, and worsen them. I think that's I'm the Cassandra. I guess everybody in my field is the Cassandra that nobody listens to when it comes to the threat of the emerging infectious diseases.
Yeah, maybe we'll get a little better about that. Somebody had a funny / oh my god tweet a month ago, which is everyone's going to look back in 5 years and try to figure out why they're following 5 epidemiologists on Twitter. And
everybody just follows me for the photos, Quinn. Nobody actually follows me for the size.
To be clear, like that's half of the reason I follow you. It's just I'm just like, how do we go there? Like, how do we get back to that life? Yeah, wow, crazy. Well, we thank you for your service now and certainly going forward. So I know you do have some news to share, which is fun and exciting. We will save that, and so maybe everybody's eyes won't glaze over, and we'll get to the end and talk about it. So Nahid, after our conversation, but at the beginning of this thing, a science writer I have huge respect for, named Ed Yong, at The Atlantic, came out of sabbatical, came off the bench to do some, along with a number of other amazing folks, including a lot of folks at The Atlantic, to do some truly tremendous coverage about not just like, what is this thing, though he definitely covered what is this thing, but why did this happen? What did we do to instigate it? How have we responded, and why? And most importantly, as we were talking about offline, he had this quote, which I'll mangle, about essentially, if COVID was a flood on a sidewalk and it exposed all the cracks in the sidewalk. And my version of that was essentially, and obviously this was going on before. And I think the first time we mentioned COVID before it was COVID in the newsletter was like January or something coming out from the wet markets in China going like, well, hopefully this isn't bad. For America, if COVID was a pop quiz on, what did we say that last Friday when everyone took their kids out of school, March 12th or 13th, pop quiz on every decision we'd made in the public health system, on our just-in-time supply chain for medicine, society-wise, inequities, pre-existing conditions, all these things. It was a pop quiz of sort of, these are all the choices you have made. These are the people you've put in office. These are the people who are on TV. These are the people who run these systems. Let's see how you did. Let's really take a measuring stick to it all. And this country did pretty abhorrently in a lot of ways, despite all the many, 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 many sacrifices made by folks like yourself who have been on the front lines and sort of knew a lot of what was coming. It's hard to think about because it didn't have to be this way. You have worked on the ground in epidemic and potentially epidemic situations. I mean, I think about what happened in West Africa for a few years while you were there. What could have happened in Lagos when they went after all the contact tracing there, which is something we've been doing since smallpox. And you've learned so much from all that. What did you feel like you weren't prepared for when this thing hit, despite all of this exceptional, very unique training for a moment like this, but on our shores?
Yeah, but it's interesting you say about this being a pop quiz, because there were definitely not surprises, right? I mean, there are the die is cast in terms of the way that these pathogens take advantage of us, and the things that we knew they were always going to take advantage of is that we have not done a very good job living with the nature around us. And as we change the structure of the environment around us, we put ourselves at increased risk. And I said this the last time I was on. We always knew that this threat existed, that there are going to be an increased chance of viruses to jump from other animals into humans, because we are encroaching into these balanced milieus where animals have lived in balance with these viruses. And now we are putting down roads, getting rid of wetlands. We are using more animals for protein because there are twice as many of us in the last 40 something years on the face of the earth. We knew that. We knew the threat was coming. We also knew that part of the reason we're blind is because we don't realize that the weaknesses in our own in the way we care for each other, and the way that I translate that in my field is like health equity. The way that we care for each other is the way that these viruses take advantage of us, and we knew that after Africa, West Africa, with the Ebola virus disease epidemic, where you saw that it is the part of the reason we miss the initial cases and they become epidemics and pandemics is because at the tail end of all infectious diseases surveillance for new pathogens are communities that don't have access to care. And because we don't care that they don't have access to care, we generally miss it when the first 10, 15, 20, 30, depending on the community you're looking at, cases first appear with these types of new infections. And the third thing we've always known is that we're not good at working with each other towards a common goal. Look at what we've been able to achieve, when we do work together, whether it's like about vaccine creations or even creating a scientific knowledge base around what drugs works and what drugs don't work. The most successful studies where things like WHO Solidarity's trial or the work that UK's recovery trial did, where they brought together tons of different populations that were able to quickly answer with one unified question, does this drug works or does it not work, right? And that's important in the middle of a pandemic, because if you start investing in things that don't work, then there's a marginal cost to that. And it's beyond just false hope. It has a marginal cost to potential impact on patients about taking resources away from other things that could work. Here's what I did not expect. So I knew all of those things.
Sure.
The thing that I did not expect was how vulnerable even well-formed advanced democracies were to interference of politics in outbreak response. I could not have predicted that, our Achilles heel, that the thing that would devastate one of the most well-resourced, countries in the world, would be actually the disinformation that stemmed from political division, right? And it's not just political interference from above, but actually political division and how human sort of relations and political division is another fault line. So it's not just that we don't care for each other or the fact that we're not good at working together or that we're not taking care of the environment, but that when we are politically divided, we can interpret data in different ways. And that can be another fault line that these viruses can take advantage of.
Yeah. I mean, the partisanship, to label it in an incredibly superficial way, that has grown quite a bit, both in volume and I think in rigor in this country over the past however long you want to say. I mean, there have always been issues. We split in half and had a civil war at one point that we purposefully never healed from. Those things affect all of these decisions we make. It's why only 50% of people vote if we're lucky, and the vote is always going to be swung by a few states. It's why, we have difficult time with long-term projects, because we'll elect one person and then the budgets go one way, and they elect one person, they go the other way. And that's, again, the things we know about and the things we're willing to talk about and to acknowledge, if not prepare for. I wrote this thing a few months ago. I can't remember when it was, because time has just no meaning to me anymore, about exceptionalism, essentially, which is, what New York suffered just over a year ago now. This is going to come out mid-May. When they talked about, you could hear the sirens in the streets every night, and that y-axis, what that looked like, and why it happened that way, which may have been due to density. It may have been down to this feeling that New York has always had of, we are New York. Again, I lived there, did my time. I love a lot of people there, but has this feeling of invincibility, and I think a lot of places in the South have the same thing for very different reasons. And I wrote it before Los Angeles got really bad in the winter, but they have the same things. And maybe it's because Los Angeles is so spread out that they didn't hear those sirens in the streets that New Yorkers did. And so maybe they just kept on not wearing masks, whatever it might have been. They have these enormous brown and black populations, a smaller black population, but the point is it's the people who harvest the food and make the food and serve the food. Well, everyone else just got to order it from home and keep their bubbles that were not tight. But this sense of exceptionalism that we continue to carry and to stand by, again, was tested and failed in so many different ways. And I'm struggling to understand, if it's sort of the rule of like, if this, then what else? Like, if this isn't going to be the thing that shatters that and realizes like we have to go back down to the fundamental pieces of the problem and build them back up, what is the thing that's going to get us there? How do we do better next time? Understanding that these fundamental pieces might never change.
The thing that, so my career is dedicated to providing technical assistance, right, to both communities here, but also communities abroad in
Sure.
resource-limited settings to help resilience against outbreak. Imagine being someone in my field coming from the US, now going to Nigeria or going to Liberia, right? I mean, it flips the whole paradigm on its head about exactly as you were saying, our exceptionalism and what we thought, we were immune to. And so one of the things that the dimension that this changes also is that it's not just resources. That the way that we get beyond this is beyond just resources or well-timed all of those are things that are needed clearly. So that's one bit about knowledge can come. That knowledge about resilience can come not just from resources. Right. Mm-hmm. That resilience is beyond just resources. And I think that you saw that there were communities that were affected, heavily affected by Ebola that did a really good job of potentially, turning, despite their low resources, turning their sort of already existing emergency coordination structures. Like we wrote a paper about this with Uganda about how the work that was already being done around Ebola was just converted into working on COVID. And there are multiple reasons. Maybe many other countries that I've worked in maybe we're not as affected as heavily. Maybe it's an age thing. Maybe it's the younger population. Maybe it's the environment. Maybe not as many introductions of the virus. But definitely a big part of it also is the way that existing structures had been used and understanding at the population level of the importance of this because they'd already gone through it with Ebola recently, right? But when I spoke about the political division, I don't even think it's just exceptionalism here in the U.S. I actually think I see that played out. I mean, look at what's happening in India. It played out in Brazil. It played out in so many different countries about, and how do you sort of start thinking about that? Because I'm a technocrat, right? I work on personal protective equipment and work on training healthcare workers and evaluating medical countermeasures. Ask me how to solve a problem. I'll give you a solution that's technical. And what this pandemic tells me is that the solutions include things that are not technical. We've always known that about public health, but so much of the solutions are political and cultural. And that's something I didn't expect.
Yeah. And we just, again, it's like, when you watch a great, did you see, came out last year again, who knows, Knives Out, the murder mystery movie, right? So great. And there's just so many of those great ones throughout history, whether they're movies or shows or books. And the best thing is always at the end, and you get to go back and see all the seeds that were planted, right? And you're just like, oh shit, how did I miss that? No, of course, that the whole time, right? I mean, this is a country, the answer can't be resources because Black moms die in childbirth at 3 to 4 times the rate of white women, right? And the life expectancy in Chicago between white people and Black people is something like 20 years. I'm going to mangle that, but I'll find it and put it in the show notes. But and when we talk to Lauren Underwood about this, about the Black maternal health thing, when something is 1.5 times as bad, 50% as bad, or twice as bad, you go, boy, something's broken there and we have to fix that, right? And maybe it's technical, or maybe it's politics or resources or funding or land use, whatever it might be. When something is 3 to 4 times as bad, or in her home state where it's 6 times, you're 6 times as likely to die from childbirth-related issues as a white woman, right? Or where you see, 70% of Black people in America are likely to live something like within 15 miles of a coal plant. Those are choices we've made. That's not something broken. That is a system that's designed that way. And that's where you go, oh, well, we'll get to the technical stuff, but that's not the fundamental piece of this puzzle. And that's where it was so interesting to me thinking about this exceptionalism thing, because I kept thinking like, okay, if Trump wasn't in charge, like, would these things have still existed, right? I mean, the whole point of Trump was he didn't just come from nowhere. He was this manifestation of 40 years of work to get to that point. And so these things were already underlying, and we have to find some way to try to fix those things, I guess, to do better. But we have to look at all these other places where it already exists. There was this statistic in Los Angeles Times put a piece, and I'll put in the show notes, something like folks on Medicaid, again, I'm going to mangle this, on Medicaid had to wait something like 80 days to see a specialist in Los Angeles, and what the death rate was of those folks. Now, again, these are choices we're making, and that's in every day. It's like the rainy day flooding that Miami's dealing with, right? Which is already a problem. But when a hurricane comes, you're fucked. When the next COVID comes, or antibiotics, or whatever it might be, what are we going to do better? And that's why I'm so curious and so desperate to get the advice from someone like you, again, who can go back to Uganda, Nigeria, and go, wait, why did this work here?
Yeah, and
I'm not trying to paint it as this like terrible picture. Like
no,
there's some
but it is.
stuff.
No. What I'm trying to think of is like, so there's a couple of things, right? There are things that are specific to pandemics and outbreaks, but as exactly
Sure.
as you said, huge part of what happens in pandemics are things that we let happen beforehand, and then we act surprised that they became compounded by a new hazard. But some of it is just an underlying inability for us to, and whether it's like, Los Angeles looking at New York's experience, it's like not learning from other people's experience, but also looking at immediate results and not making future investments. And we do that in environment, which you know very well, about how we spend our carbon, our carbon footprint every single day, borrowing from future generations. But we're kind of doing that in terms of what we do with pandemic preparedness as well, is that we don't make the investments now for future gain. We're not thoughtful, enough. And part of why potentially is that we think in individual terms rather than we should be thinking more in communal terms, in trying to say what is a greater common good that we are all donating or dedicating towards. And not enough of that happens. And I don't think that's just the US. I think it's just it's a human thing. And for us to get beyond these existential crises of climate and existential crises of emerging pathogens, that's the shift. That's the basic shift that we need to change is investment now for a future that we don't yet see, that we may not individually benefit from, but that we will make the world a better place with.
And this is where, and I do want to focus on going forward now that we've talked about how sad everything has been, because there are enormous, fundamental, transformational things we can do. And these systems are so complicated and complex that they can start to pay off in a number of different ways. But we have to be honest about what's out there. We had on a wonderful author, and she's now the opinions editor for Boston Globe, Beena Venkatraman. And she wrote this amazing book. Oh my God, she's the best. She wrote this amazing book called The Optimist Telescope. And she always yells at me. She's like, you promote it as if you're my brother. She's like, we've met twice on Zoom. But it stuck with me. And the thing that really, the whole book's great. And I fully subscribe to that perspective. And she had this one thing that we talked about at the end that has stuck with me. And I've made it a fundamental part of basically like how I live my life, but also how I conduct this business and have these conversations, whether they're offline or online. And I think using a near-term vision of this would be profoundly helpful for this conversation, but also going forward, which is, she asks, how can I be a better ancestor? And that's really specific. And she made the point, she doesn't have kids, and I'm not sure she's planning to. I've got 3 mutants back at home who are incredibly privileged and healthy and fine. But how can we be better ancestors, even though we'll probably be around for the next version of this? And climate is already happening to so many people. More people are feeling it ever. Redfin just ran this whole huge poll, and people are moving for the first time because of climate change. What are the things we need to do specifically in this country And then, of course, abroad, though a lot of places handled it much differently and much better. What are the things we can do to set the next generation up for success? You know, all these kids who are, I mean, I'm so inspired. Like Generation Z gets such a hard rap, and yet these kids are out marching in the streets and they're trying so hard, and they're going to have a lower life expectancy than their parents, and they can't afford houses and to get married and to have kids and things like that. But they're going to be in charge. It's a pipeline. This is the way things go. So how do we set them up to be able to do these things when they're carrying so much college debt, you know? And so they're going to have to go be a lawyer in finance. I want them to do what you do. How do we set them up? What are the systems we need to take apart and then rebuild here to make those fundamental things work, to set them up so that this can go better next time?
Well, you got the wrong guest. You got to find somebody who has solutions to those. I'm just an ID doc. They don't pay me the big bucks to answer those questions. But I do think there are specific questions. I mean, I think how do we set ourselves up better for the next one, right? Because there will be next one. One, and there are ways that the projects, and I think we talked about some of these as well. One is that we need to keep our eyes closer to the ground here globally, and we do that by looking at both animal and human populations, particularly at that interface. You know, and there's a lot of projects like the Global Virome Project that's looking for potential, which you might have heard of, and Ed might have spoken about. I'm not sure, but the idea of like looking at those viruses that might make a jump. You know, so that's and even before that, like we work by decreasing the chances that the viruses do jump, and part of that is being more sustainable in the way that we interact with the nature around us. And it's, you know, and again, it's not in my field, and it intersects with my field, so I won't deign to sort of comment on that. But the idea that it is that existential crisis is tied intimately with this existential crisis, and we cannot separate the two. You know, but my role starts once we start getting into once the virus jumps into humans, right? The other is keeping our ears to the ground in being able to pick up these diseases, and that actually means work that's already been done since Ebola, since we last spoke. A lot of the work on things like global health security, which is helping countries develop the ability to surveil, detect, and respond to emerging pathogens, right? But all of those were, again, very technical answers, right? This is a huge part of global health security was helping set up the infrastructure, finding where those infrastructure is, finding where the gaps are, helping the international community find that everywhere, like here in the US, you know, Uganda and Liberia and all the different places that I work with. And then there were other technical solutions, right? The other technical solutions that came out of Ebola, where the WHO developed the research and development priority list. They identified these 10 pathogens that are going to be, they know are going to be potentially epidemic, you know, threats. And so this is where the infrastructure could be put to create readiness, you know, and actually they have something called Disease X, which, you know, now that we have COVID moves out of there, Disease X still stays. And the third part is something called the Coalition for Epidemic Preparedness Innovation, which was a multilateral, private, as well as public and academic collateral sort of consortium that put funding into developing vaccines for the diseases that were on WHO's R&D list. You know, these are all very technical answers, right? These are like, how do we get these vaccines developed? And these are important. These are very important. But if I look at like the kind of stuff that as we move forward to global health security, like what has COVID taught me in terms of the kind of things that I think we need to do? And we talked about one, which is this idea of political interference and how do we or politicization, how do we move out, you know, our response from the divisions that sort of plague us? But the other non-technical things are the role of disinformation and misinformation. We are we are the people of our generation. We are overwhelmed with information, and the flood of information brings both the good and the bad. And we haven't yet mastered that, particularly about how do you get critical information out to people when there's a deluge of information being sent their way so they can make decisions to save their lives.
Sure.
We don't have an answer for that yet. And this pandemic has made it so clear because there's so much confusion about whether pandemic is even, you know, whether the virus is even real or not, whether masks help or not. And because it's not, yes, there might be malicious aspects of it, but there are, majority of this is the volume of information that's coming at people. And there's potentially a technical answer to this, but there is a societal answer of how do we manage this, to get timely information out to people, to get timely information back from people about what's affecting them, right? It goes both ways, I think. The other is equity, realizing that inequities, all the things that we talked about, inequities will always be our fault lines in how we break. And when we break along those lines, it affects everybody.
Sure.
And that, that you can't, when you work on the technical answers of pandemic preparedness, you have to pay attention to like community vulnerabilities, right? Mm-hmm. One example that I always use is like, how did we completely manage to not support our frontline workers, essential workers who are in multi-generational families and communities of color? We gave them we just said, here you go, here's a cloth mask. Good luck to you on those front lines, right?
Please don't let me get this.
Right. We helped our healthcare workers a lot more, but there was no guided, specific guidance for frontline workers. And that's an example of what we knew was a fault line, but we did not work to bridge that fault line so that our frontline essential workers weren't heavily affected and didn't take it back to their families who were disproportionately affected. And then the last bit that I'll end with is I was, as a science nerd, I was just amazed by what we can accomplish when we put enough money and resources. We have vaccines that are inequitably distributed right now around the world, but we have a vaccine that within a year and a half or something of this pathogen getting on the scene are helping us get back to normal. And there are still diseases that have been plaguing societies, for decades, and we haven't figured out how to do that. And it tells you that it's not just about technology, it's the political will behind funding those things. The science can work. The science is promising. We just need the funding and the political will behind it.
Yeah, and it would be great if we didn't have to concentrate for 1 year, stop all of the other science and throw it all at one thing. It's a little bit of like the Armageddon Bruce Willis thing where it's like, how much money do you need? Doesn't matter. Like, we got to do all the things. And so I'm sure that was profoundly helpful in getting probably one of humankind's greatest achievements, these 2 vaccines, to be so effective and to happen so quickly when most vaccines fail. I mean, we see this shit every day, right? Most things don't even get to stage 2 and 3 trials. People have no idea. But hopefully it doesn't require that. But at the same time, you're starting to see like, oh shit, how can we think about malaria differently? And so you saw the news about that this week. That's just profound, right? But there's also basic things. And I think back, we had this wonderful conversation with Karen Huster, who worked with Partners in Health on Ebola. We
worked together.
Oh man, she's the greatest. I loved that conversation. But she talked about, and I want to go back to your disinformation thing, which is like, look, if there's anything I've realized this year with my kids or life or COVID is like, control what you can control, right? All you can do is all you can do. So you and I can't do anything about the pure volume of mis and disinformation that's out there, but we can control, hopefully, the information we are putting out and the institutions we work for and support and we're behind, right? Or we're inspired by, or we believe in. And so much of that comes down to, I remember her talking about the disbelief and the disinformation around Ebola and getting people to just be treated and what that meant. Because the thing about a pandemic or an epidemic on a relatively smaller scale is it is inherently not Black kids getting cancer because they live next to a coal plant or getting cancer or asthma, right? Because I can't give you, Naheed, I can't spread asthma to you. But these things, the correct information and how we provide it is a public good because, as everybody has learned, if you didn't know what the word pandemic means, it means I can give it to you. So we all win. It's this whole we're trying to figure out how do we message people to go get the vaccine because now we've done all these work. We got to do the hard work, whether it's evangelicals or people who've listened to Trump, whatever it might be. To understand, like, look, man, it's not just you getting your life back. It's you're protecting your family around you and all these things. And that's where I come down again to these first principles. And I saw you joined this group, Menteca. Is that right?
Mm-hmm. Mm-hmm.
And there's this piece on their website, if I can read it real quick, which says, addressing future epidemics and pandemics requires an emphasis on basic health care, which is exactly the area most neglected in conflict-affected non-state spaces. If any type of healthcare is present in such areas, it's usually emergency care, and I know you've done that. And so the goal is to strengthen the capacity of local health workers and communities to carry out public health activities in non-state spaces, other hard-to-reach areas. We don't do that here. I mean, my friends who work in rural hospitals, I mean, to talk about, people don't have, the women who don't have reproductive care, because we keep taking that away. They got to drive 75 miles and then see 3 ultrasounds. How do we start there? Like, what have you learned from that we can apply here? That feels like semi-technical. How can we start to level that up so that when the information gets there, people have been taken care of and we've been emphasizing wellness and we don't have so many of these pre-existing conditions that are susceptible to mortality?
Yeah, I think that the part of what Medtech says on their website is exactly what I said to you before, which is that I think that our blind spots to this existential threat, which is pandemics, is the fact that majority of the people on the front line don't have healthcare, right? It is that it's, and we forget that because I think part of the issue here in this country, and I'll talk about this country and I'll talk about global before.
Please.
Part of the global after, rather. Part of the problem here is that you just talked about the difference between what makes infectious diseases different than other things, which is that our destinies are tied. But that's not how we think of health, right? Our health at baseline for us is a individual responsibility and a private commodity. Sure. It is not a public right. It is not it is not part of the public sector, and that's okay. But it's not something we think that people have a right to. We think is the thing that people pay for, and the quality of it is sometimes linked to the amount of money that they pay for it. Sure. And that's a different way of thinking than the kind of thinking that's required when you deal with communicable diseases, which means that your health is my health. If you don't have access to care, if your baseline health is not well taken care of, then you're affecting, your own health, but your health and your ill health is affecting the community health. That all of a sudden it becomes not about the individual's right to versus not right to health, but the idea that the community's destiny, the entire community's destiny is sort of tied to that. And I do think part of that is just better primary care. It's better primary care here. And by the way, the answer is the same everywhere else as well. It's this idea of how do you generate enough, how we get eyes on the ground, how we create resilience is by creating that infrastructure to get everybody a basic amount of care so that that their health then becomes reflected in the better health for their community, which means better resilience for the rest of the world. So that's one. But the other is targeted surveillance for infectious diseases. So I'm on the organization that you mentioned, the Manteca organization. Tom Gregg, who's the founder of it, has done a lot of work on polio eradication, and particularly in polio eradication in conflict-affected areas and areas where you can't really get access to populations because of the non-state sort of non-state nature of them. And the organization that he was working with before, the Center for Humanitarian Dialogue, some of the lessons that they learned were, you can't go into communities and say, we're worried about this disease, let's focus on this disease, whether it's Ebola or polio or COVID. Sure. You have to go in those settings, or even before, you have to go in to sort of understand all the community's needs, right? And the way that you convince people, or the way that you have a conversation even about vertical interventions like vaccines is you listen, you understand the perspective of that community, you figure out who the trusted messengers are, you're invested, that it's not a one-time vertical intervention that you're going in with. And so the fact that we can have the way that we have good surveillance is that we need to sort of understand the larger sort of weaknesses or the fault lines in those communities, and then put in good surveillance so that if we find one, we ensure everybody's health, but then if we all of a sudden find a larger sort of jump in cases, of acute illness of something, that we've made it so that the system not only provides care, but the system picks up fluctuations. And that was that's the basic level of surveillance, right? The basic surveillance is access mortality. And that's the concept that if in a community, all of a sudden you get more deaths than what you were expecting, then you should look into that. There must be something going on acutely that's changed, because all of a sudden, this month
it doesn't just happen. Yeah,
it just doesn't happen. That's the basic level of surveillance. I got to tell you, Quinn, there are parts of the world that don't even have that. They don't have a handle on excess mortality. They can't tell you if more people have died in their community. And there are fewer, thankfully, communities like that than there were there about 10 years ago. But and that's the issue, is that our surveillance is not even good enough to pick up if all of a sudden there's a bunch of people who, in some areas of the world, they might have died, and we can't sort of expect that. So the surveillance needs to include access to care. It needs to include ability to pick up changes. And then it needs to be included in more technical things, such as laboratory capacity. So now it's good enough you found out a bunch of people are dying, but what are they dying of? And I can tell you as a personal experience, as someone who's worked in resource limited settings, there are parts of the world where there are entire hospital wards that are filled with people who don't have a diagnosis because there's no capacity to test them. And there are people who die without a diagnosis and not knowing what they died of, without their family knowing what they died of. And the next level beyond what we're just talking about is building that laboratory capacity. So, we know what they died of, but they know what they died of. And there's a Gates, just to tell you how prevalent this is, Gates Foundation has a program called CHAMPS. I think it's a childhood mortality, under 5 mortality, figuring out what children are dying of in parts of sub-Saharan Africa through autopsies and through, getting a sense, because we don't have a handle on that. And so that's the next solution. It's equity. It is, ears to the ground, is laboratory capacity, and then it's access to treatment. Because, if you don't have that ready, what's the point of diagnosing people if you can't link that, the ability to provide good quality of care? Because good quality of care and the capacity to isolate people and provide that care is what is the fire break that keeps an outbreak from going out of control. If you have good resources to, bring people into care to solve their disease, so they are not in the community longer, potentially getting their family members sick, potentially getting, their community sick, then what's the point? So those are the technical answers that I know those sound really simple, but they require global cooperation, and they require a lot more sort of shifting in the way that we think about individual responsibility and community survival.
Well, it sounds simple, but it's the simple things we're not doing, right? And from the basic healthcare or wellness or more primary care or getting people to take their medications, whatever it might be. And like you said, just local day-to-day surveillance is what enables us to level up so that when something happens and we over-index on something, even if we don't know what it is yet, we're able to respond to that because we have a beat on that and we have a good relationship with the people in that community, right? Like you said, it's no fun when somebody swings in and it's one time and they're like, you need to do this. It's like, well, who the hell are you guys, right? No matter how bad it is. It's, there was so much stuff early on about, South Korea is doing great because of this, and Japan's doing great because of this, and this, and this, and it's because, and Vietnam, and it's because, a lot of that is they learned a lot from SARS, right? We didn't get that. And they learned, which was very different. I mean, you got SARS, like within a day, you were in deep shit. And of course, the asymptomatic versions of this made this much more difficult, of course. And America's designed to be federal, states' rights, complicated 50 different versions, everybody bidding against each other for PPP. They're inherent things that are just going to be unfixable, but at the same time, hopefully we can say like, okay, now 10 years from this, what have we learned like they did with that, and to implement those things so that surveillance isn't a scary word. And so that when it does happen, you can start to do the technical things that can make people better, that can be that firewall. So what's your role in this going forward? How are you going to make us not screw it up again? What have you learned? What, in the lab sense, in the policy sense, in the research sense, like how does that all come together from you? And I guess it's a hell of a thing to go through something, whether it's your profession or not, right? And it's easy and helpful and daunting and scary sometimes to put everything in perspective quickly. It's like losing a loved one and you go like, oh shit, none of that other stuff is important. Here's what's important. What's important to you over the next 2, 5, 10 years and how you apply yourself?
So I'm actually going to continue to do a lot of what I'm doing, but I'm taking on a new venture, which you foreshadowed with at the beginning of this show. So we're launching a center at Boston University called the Center for Emerging Infectious Diseases Policy and Research. And it's bringing together all these disparate threads of the work that I'm doing already globally and here. And really the goal of this, Quinn, is exactly what I said, is that it's finding those fault lines and filling them in beforehand. It's raising awareness about them. It's doing research around them. And the 4 themes. And so the center, seed, easier to say, right. The BU seed. The big goal is to generate sort of like evidence-based programmatic and policy research and around 4 particular things. And one is resilience, and so it's community resilience, like the kind that we talked about. It's recognizing who's going to be at risk and building those fire breaks beforehand. But also things like conflict, a conflict in infectious disease surveillance, finding the other blind spots. Let's find all the blind spots and shine a light on them and fill them in with resources now. We're also working on the health equity elements within that, because I think we've recognized how important that is. The other is healthcare systems resilience. We are one of the best resource healthcare systems in the world, and we suffered under the surge of these infections. And as we look forward potentially to the next threat, or as we walk towards the next threat, like what do we learn from this threat that we can sort of use to build more resilience within our healthcare system, whether it be supply chains or whether it be better integrating research into care so we can quickly answer questions about how do we provide better care for the next 100 patients that come in with this disease. We're also looking at governance and the idea of how countries are beholden to each other and right now when there's a threat within their borders, but then also how we work together, with research governance to try to increase sort of awareness about the existing threats, but also answering on what the right sort of vaccines, the diagnostics, the therapeutics that are out there together in a fast, in a timely manner. And with that, I mean, I'm interested in, this is not my field, but the blind spot that I had, which is this idea of how political systems and their mechanisms of accountability or lack of accountability can actually make outbreaks worse or better. I'm sort of interested in that. We're also working at trust. Here's the thing, right? The biggest, I think, surprise to me is that we talked about pandemic preparedness, but couple elements that we left out, the big one that we left out in terms of response was the community, people. We're very technical in our answers. And in fact, what you need is trust, right? That's sort of the third thing that we're working on is building, looking at misinformation and disinformation, looking at how public health folks work with media to get that information out, particularly when there's scientific uncertainty. Look at how geopolitics plays a role in spreading disinformation, and then lastly, innovation, looking at emerging technologies that are going to be coming on the scene for the next 10 years and their impact, their challenges, getting them to a point where they're equitably accessible for more communities in the world. So that's what the center is doing. We're going to be funding and doing research in those things. We're going to be hosting a ton of events, community-facing events and public-facing events. We're going to be advocating to legislators and providing them with the technical resources that they need. And as a lifelong student myself, we'll have a lot of opportunities for students and researers and others to collaborate with us. And so that's on top of my, everyday travel everywhere.
You don't have shit else to do. So that's great.
I'm not going to give that up. I'm still going to be doing all the other work that I'm doing globally, but that's the next big move.
So super exciting. How big is this venture people wise? Like, what is it? Is it you and your laptop for now? Like, are you hiring like crazy? Is it 200 people, 500 people? Is it the Avengers? What are we looking at?
I do feel like I'm building the ship as I'm sailing. So we have a core staff, and we have faculty here at BU as well as faculty across sort of the country and multiple other academic centers as well as nonprofits and elsewhere. But it is small now, but the goal for it is to be focused on the right things, focused on the things that need investment that we've seen sort of missing, coming out of this pandemic.
So if I'm a young person, which I'm not, and I am coming up in high school or college or grad school or med school, whatever it might be, PhD, and I've got infectious disease on the brain, which now that I think about it could probably be phrased better. Where would you encourage those folks to go now, knowing what we know, knowing what we don't know, knowing how much work there is to do on this? You look at what Sam and Brandon are doing with, global.health, which is like sticking with this and trying to figure out like, okay, what does it actually do and who is affected and why and what have we learned and what's going to happen? Because this thing isn't going anywhere, Where would you point these people? Where are the different places that would be inspirational and practical and where they could actually make a difference?
Yeah. Well, one thing, I don't know if we talked about this book last time, Quinn, but one thing, the book that I would suggest is Spillover by David Quammen.
Yeah.
It talks about sort of the connection. If you're inspired and you want to see the connection between the human and the environment, and how these pathogens arise. And that's a good example of the tapestry that we exist in, and describing the tapestry that we exist in. I think that the lesson for me is that you don't need to be in the sciences and you don't need to be in technology to do this. We recognize very clearly that you can help with pandemics from many different ventures. Whether it's culture, whether it's policy, whether it's there's a ton of different things. So figure out what you like doing, and then apply that to the cause of the response. I think that for most people, if you are interested in getting into the technical aspects of it, it's not a bad idea to start taking courses, potentially focus on this in both your college or in your undergrad, to see if you enjoy the subject matter. And if not, then maybe it's like I said, there are many other disciplines that you can go into. And then lastly, check out our website. It's there's many organizations you should check out, but I'm gonna forward you to our website, which is www.bu.edu / or is it / I don't know. CEID.
Oh, the kids will know. They
will figure it out. Yeah. And you can find us on Twitter, but it's bu.edu / CEID, seed. And we will, on that website, you'll find a ton of other resources getting you to the places that we hope you can find more information from.
I think about that. And like you said, we're big fans of the question I feel like I get when I'm in the back of an Uber or conversation or whatever it might be, or kids or whatever is whether it's climate or something else, is what can I do? Or it's phrased, what can I do? Or it's more desperate and it's like, what can I do? And the easiest, most simple answer is like, well, what can you do? Right? Which is like, it's the conflux of what are you into and what are you good at and what brings you joy or inspiration or progress, whatever it might be. And I think about this, like you said, you can contribute in so many different ways. I mean, like you said, messaging has been a huge part of this. Communication has been a huge part. Political leadership has been a huge part. And I just wonder as President Biden works to make community college free and things like that, and we look at the difference in voting, whether it's high school degrees versus college degrees, things like that. College isn't for everybody. Fully get it. I loved it. It's complicated. It's totally broken. Way too expensive. Pros and cons across the board. Community college can be amazing. Vocational training can be amazing. Fucking just Khan Academy can be incredible, right? But it seems like this basic level of education on things like probabilistic thinking, right, would be super helpful. How infectious disease works, literally just like a 101 for everybody, seems like it would go a hell of a long way, whether you're going to eventually get into this or not. It's something that might just stick with you later when you're trying to decide what you want to do or when the next one comes down the pipe. And I wonder if that's something that we can be pushing alongside all of this, acknowledging this is going to happen again.
Yeah, I do think there are a bunch of new organizations that are looking at that. And there, like you said, Khan Academy is a good one that's already done that, which is public education around scientific concepts is going to be important. So that is actually one of the things that, we'll be looking at is those tools and exactly some of the things that you're talking about. Simple concepts like what's an R naught? What are we talking about when we're, all these epidemiologists you've been following at Twitter, what have they been talking about this whole year? And so it's things like that. But I want to point out to one specific thing everybody can do, particularly the young listeners. Right now, you can do one thing that's going to change the destiny for yourself, for your community. It's going to change the course of this pandemic for the rest of the world, and that's to get vaccinated. And that's because the COVID vaccine not just protects you, but it's going to keep you from getting the infection silently and passing it on to somebody else around you who may have taken the vaccine, but their immune system maybe was not good enough for them to get protection. And so you are protecting others. You are allowing all of us to get back to normal if you take that vaccine.
It seems so easy. I empathize with people who are scared of needles. I empathize with people who don't trust the medical establishment. I empathize people who are confused, even earnestly, from misinformation and disinformation. I get it, but we if there's anything we have a certainty about in this thing, it's almost more than ever. I mean, vaccines are incredible, but these ones are truly incredible, and they're proven. I mean, you look at Israel, who's just coasting. It's incredible. And we can get there. It's going to be a lot harder. We're not the same place. It's just like when everyone's like, but New Zealand and Australia, I'm like, that's great. They're islands. That must be nice. Their leadership did a good job, but come on. This is a very different place, obviously, but this is the thing. This is the thing that works no matter who you are. That's another one that could be added to the educational list is the term efficacy and how that's I mean, the number of times I've seen just epidemiologists yelling at media people online.
You need to come and work for us, Quinn.
Oh,
you can guide
Jesus.
us on all the topics. Just send us all the topics we should make videos on. We'll be happy to do that.
Oh, God, you don't need that. It would be very unfortunate. So that's what they can do. That's the number one thing. What about, we've got elections coming up in a year. This thing is going to happen again. What are the specific questions we should be talking about and asking about with our local representatives, state representatives, et cetera, et cetera? Because this thing, like climate change, happens on a local level.
Yeah. Well, I think you start off by saying, what are you going to do to pandemic-proof our community next time? What are the investments that your campaign, your government is going to be looking at to make my community safer? And the second question, and very much tied to that, is what are you going to do to ensure that there's equity, the health equity, so that we're all protected in the same way, and so that vulnerability of some does not just heavily take a toll on those communities, but also leaves the rest of us vulnerable. So you can't have, it's like the flood analogy. Like, if the levees fail in some parts of the city that you share, with other, and you may not live in the neighborhood where the levees failed, then they might be the heaviest affected, but we're all going to be flooded, and so if you need a selfish reason for health equity, then there's your selfish reason for health equity. And the last bit, I think, is what are you going to do to put good information rather than disinformation out? What are you going to do to combat misinformation?
Yeah, that works. Last few questions. I'm going to get you out of here, back to saving the world here. Nahid, who is someone in your life that's positively impacted your work in the past 6 months?
Selfishly, my parents.
Have you seen them?
Yes. And I cannot tell you and I think this is true for many, many different people. And I say selfishly my parents because they have been the touchstone from which they are the point of my resilience. I've realized my family is. Yeah. And I think it's been true for many of us. And I know I say that with heaviness in my heart because I know there's many who lost family in this last year. And they, watching my parents and watching them get vaccinated is, watching them become safer was one of the most powerful experiences of my life. And it became personal. It always was personal, right? Like I went through West Africa, and watching sort of like the tragedy that played out in Ebola treatment units was what drove me, after the years after that, to continue working on this. And now it's actually watching the vulnerability of my family potentially in this pandemic and seeing them come on the other side of this, that I just, now this is the thing. It's home. It's trying to get everybody's family and home safer.
Sure. I'm calling you from downtown Colonial Williamsburg, but we're surrounded by military here. One of my best friends is a submarine captain. We got Air Force, Navy, the whole thing. And we've got these 3 airports. And what's great is at really any given time, but specifically around the holidays, if you're in one of those airports, all you see are like children running towards the mom or dad coming home from a military tour. And if you're like me and you're Irish, you literally just cry all of the time. And the new version of that is the grandparents being reunited with their grandkids after your videos. I just literally watch those on a loop all day. It's the greatest you could ever feel. It's the greatest thing in the world.
Yeah, so, the motivation is very close to home for all of us for the next one.
Yeah, absolutely. I mean, we know now what's at stake and how quickly this can move, even with the best of intentions. Any new or reliable self-care that's working with you besides starting a new center for research because you didn't have enough to do?
Yeah, I mean, the same thing that we've always done, which is, exercise. And I think that even though I'm sorry to say, Zoom, the company, you've done a fantastic job, but I just hate Zoom meetings now.
It's not their fault. It's the paradigm.
It's not their fault. It's the paradigm. No. They're wonderful. And they've done an incredible job. But my point is that I have recognized how much closer I found myself reaching out to people and who I didn't have time for, and they didn't have time for me before, who I knew I always loved and respected. And now I can just do a Zoom call, and the pandemic is sort of put the barriers down to sort of do that, right? And so I think that even though we're going back to normal, I know that I'm going to be doing Zoom calls, or Zoom gatherings with my friends from across the world, and it's going to bring us closer. And so that's been another part of the wellness. And the third is recognizing my own limits, and being okay with that, because it's the pandemic, man. It's all right.
Yeah, it's okay. It's enough. I mean, my job is about 1/10,000th as vital as yours. And but I do too many things. And my therapist is fond of saying, like, your load and your limit can't be the same thing, man. Maybe like once in a while in crunch time, but like that can't be the way things are going. Like, it's not going to work, pandemic or not. And it is important to take a step back and be like, things are a little difficult. Maybe give yourself a break.
Yep.
What's a book, last question, that you've read this year that's opened your mind to something you hadn't considered before, or it's changed your thinking in some way?
I'll have to go on my desktop or my bookshelf to try to figure this out. I did read The Plague Cycle and Get Well Soon, but of course these are all in my field, and so I can't really. But Get Well Soon actually was a really good book. It was Jennifer Wright, I think, historical perspective on infectious diseases. I can't seem to get infectious diseases off my brain either, but it's an interesting perspective, and because it sort of goes through. What I'm always fascinated about is not just science and technology of it, right? But it's how through the ages we've interacted with the existential crisis that is these infectious diseases, and the social elements of that. So I said it further expanded rather than completely changed the way. But Get Well Soon, really a quick read, very very fun read, very historical read, and timely right now.
Sure. I love that. Anything else? What did I not ask, or anything you want to say to speak truth to power here before you go off and conquer?
I hope this makes us a kinder species. I think that it's not truth to power. Maybe it's truth to ourselves. I think that we were so impatient with each other before, and maybe we'll be that way again the minute we take those masks off and walk in and get into a crowd again. But I hope that this seeing our own vulnerabilities, I hope it makes it kinder. It makes us kinder to each other. And I hope that it makes us more patient.
Yeah, that works. I think you'd appreciate this is the sign on my wall. Can you see that?
Yes. Work hard and be nice to people.
It's not too hard. I can understand how in tough moments we've all got a snapping point, but our baseline for a lot of things, clearly, you would hope this changes it a little bit. Those things go a long way. Doctor, I can't thank you enough for coming on, for taking the time for all you've done this year. It's crazy. People see you on the news all of the time now. And I'm excited to hear where this new group goes. It's very exciting. I expect you'll just make it all better. So that's great.
That's a lot of pressure there, Quinn. No pressure. Thanks for having me. It's
absolutely.
I think last time to sit back. Yeah.
I think last time I said, next time up in Boston, we'll make something happen, and then no one was allowed to go anywhere for a year and a half.
We will.
We're going to keep that on the table.
It's on the calendar.
I love it. Well, listen, be safe. Thank you for everything, and we'll talk to you soon. Thanks to our incredible guest today, and thanks to all of you for tuning in. We hope this episode has made your commute or awesome workout or dishwashing or fucking dog walking late at night that much more pleasant. As a reminder, please subscribe to our free email newsletter at importantnotimportant.com. It is all the news most vital to our survival as a species.
And you can follow us all over the internet. You can find us on Twitter at importantnotimp.
Just
so weird. Also on Facebook and Instagram at Important Not Important. Pinterest and Tumblr, the same thing. So check us out, follow us, share us, like us. You know the deal. And please subscribe to our show wherever you listen to things like this. And if you're really fucking awesome, rate us on Apple Podcasts. Keep the lights on. Thanks.
Please.
And you can find the show notes from today right in your little podcast player and at our website, importantnotimportant.com.
Thanks to the very awesome Tim Blaine for our jammin' music, to all of you for listening, and finally, most importantly, to our moms for making us. Have a great day.
Thanks, guys.